let's learn more about prescription drug coverage. If you're currently taking medications, it's an easy decision to include Part D coverage when you enroll in Medicare. But what if you don't currently take any medications? If you don't enroll in Part D when you're first eligible, the government may require you to pay a late enrollment penalty that will continue as long as you are enrolled in a Part D plan. You can avoid the penalty if you have prescription drug coverage through an employer or the VA that's equal to Part D. Once that coverage ends, you'll need to sign up for Part D right away. Our prescription drug benefits and covered drug lists, also known as a formulary, vary by plan. All plans have a network of pharmacies where you can get your medications, and some give you access to preferred pharmacies that offer special pricing for our members. Before choosing a plan, it's a good idea to see if your drugs are on the plan's formulary. To check, visit regence.com/Medicare and use our search tools. You'll find that covered drugs are assigned to a tier, and what you pay depends on which tier your medication falls into. You'll also be able to see if the medication has limitations or restrictions or requires prior authorization. When you start using your prescription drug coverage, you'll first need to meet your plan's annual prescription deductible if there is one. Then you'll pay a copay or coinsurance for each prescription until you and your plan's spending on prescriptions reaches the initial coverage limit. After the initial coverage limit is met, you enter the coverage gap, also known as the donut hole. You'll pay 25% of your plan's negotiated price for generic and brand name drugs until your spending on prescription drugs reaches the total out-of-pocket threshold. Once this threshold is met, you enter catastrophic coverage, and you'll only pay a small amount for your covered drugs for the rest of the year. Your plan pays the rest.